Guess they ought to bring my face up there. Don't want to miss my lovely face. So I want to talk about some information from global research that I thought was particularly important because I am asked this question. I'm asked this question constantly, and I'm asked questions about the new food pyramid, which I highly endorse. I'm asked questions about, oh, what can people be eating that will make their brain work better? Ketogenic diets. That's really simple. Get rid of the processed carbohydrates, get rid of the processed meats, get into eating the food that Mother Nature created for you. And it's interesting that it's so hard for people to make that switch, to be able to actually start eating something decent. And then a lot of times they think they already are. When people tell me that they're eating a good diet, I ask, well, what's it consist of? And they would say more salads. Just part of the programming out there. Eating more salads is not a healthy way to go. We have a very hard time digesting plants, period. We're omnivores. We're designed to eat plants. We're designed to eat something that ate the plant kingdom. But just to assume, and good morning to you, Wendell, just to assume that somehow by eating more salads we're going to be healthier is not clear thinking. And I think I'll find time to get to that. But the main thing I want to talk about is the vaccines. And one of the biggest con jobs in modern healthcare goes back to the 1700s. And because it's such a great money-making proposition, it will continue to be a very large part of the construct of our current culture. But when you study it, and there's great sources of information to study, when you have children that have been damaged by it, and in some cases irreparably damaged, the negative side of this is not going to go away at all. Now, vaccines cause various side effects. Some of them are very subtle. Some of it makes it very hard to identify common causes, many of which overlap these mysterious, suddenly coming down with this mysterious incurable ailment. But don't worry, there's research going on about this particular problem all the time. And it almost invariably involves the central nervous system. Now, neurologist Andrew Moulden, M-O-U-L-D-N, discovered some time ago that vaccines frequently trigger microstrokes, which can lead to a myriad of acute and chronic diseases. And there's research that goes back to the 1960s that show that blood cell clumping is a root cause of many diseases. It's a part of the construct of Chinese medicine that the little testing stuff that they do, recognizing that blood cells will clump up. They're not supposed to clump up. They're not even supposed to touch, except in the most concentrated circumstances in capillary beds. Now, colloidal chemistry and something called the zeta potential reveals that positive charges around blood cells cause clumping. Now, agents that have concentrated positive charges, such as aluminum and the COVID spike protein, are especially problematic. Now, I know that sounds kind of backwards, that if red blood cells have a positive charge around them, they should be repelling one another, shouldn't they? It's the same thing with all of the protons that make up the core of the atom structure of the elements. They should be repelling one another. Like charges repel. Well, that's where the strong force comes in, and it gets down to the concepts of atomic theory and the kind of energy that is released in atomic or hydrogen explosions that releases the energy that is contained in the nucleus, and that massive field that exists between the nucleus and the electrons of energy. But when we're talking about red blood cells, they're forced into a clumping kind of condition. No, not clumping, a concentrated area once they line up single file. This is how small your capillary beds are in the tissue. Red blood cells have to line up single file to get through those capillaries, to drop off their oxygen and pick up carbon dioxide on their way back to the lungs. And improving the ability of your body to handle this kind of a contradiction benefits a wide range of acute and chronic illnesses. Now, a strong case can be made that many of the conventional and holistic therapies work in part by enhancing this kind of a potential. Now, many medical problems stem from the diagnostic approach of physicians, especially with complex illnesses, which are often misdiagnosed and lead to ongoing patient struggles. I remember reading some research, it must have been 20 years ago, that said that 1 in 5 people who pass away, succumb in the hospital, 1 in 5 actually died from the reason they were admitted to the hospital. Not that the hospital caused all these other problems, but that they were misdiagnosed. And complex problems, complex conditions with varied symptoms across patients resembling other kinds of illnesses, such as fibromyalgia or chronic fatigue, that end up being a catch-all for a lot of misdiagnosed concepts. And in turn, poorly trained physicians often default to sending you for psychiatric examination, overlooking the real actual cause. And as vaccine injuries have a wide range of symptoms, they have confused doctors ever since vaccines showed up 200 years ago, with a lot of doctors in the past just labeling it as encephalitis, just brain inflammation. Now, according to Dr. Moulton, there are 3 main mechanisms that underlie the myriad of chronic illnesses, including vaccine injury. And the major one he talks about is one I talk about all the time, which is immune dysfunction. Vaccines frequently cause chronic autoimmune disorders and varying degrees of immune suppression. This is one area that the alternative medicine looking at with lupus. Lupus, in their mindset, is a collection of several autoimmune disorders brought on by over-vaccinating. Another problem involved with it is impaired blood circulation. It causes fluid clumping, where you get micro blood clots and blood thickening, and it obstructs the blood flow through the capillaries. And there are other factors, obviously, they can do the same thing as well, but one of the primary issues with the COVID-19 and vaccine spike proteins is that it carries a very strong positive charge density, which triggers clumping in fluids throughout the body. That's why the COVID-19 vaccine became known as the clot shot. And then there's the danger of what's called cell danger response. When shocked, such as from a toxin or a loss of blood flow, cells can enter into a very primitive state under the threat of death. And so you end up stopping normal mitochondrial function, and severe inflammation results. And this temporary state can become chronic, underlying many of severe conditions, particularly those which worsen rather than improve with the various treatments that are applied. And so treating this response has resolved conditions that are linked to vaccine, like autism, and complex illnesses. Restoring health often requires first addressing the underlying cause of a patient's illness and then resolving the cell danger that the response triggers. And while not the most potent tool, interestingly enough, I've known about DMSO for decades. I've probably known about DMSO for 50 years. But it's interesting the effect that DMSO has in helping to reverse a lot of the vaccine damage. The research, there's a lifetime of research on the subject if you go out there looking for it. And it seemed to be able to cure a myriad of seeming unrelated illnesses which did not respond to other therapies. And likewise, why only a fraction of people with those illnesses which typically respond to DMSO did not have a disease resolution from the DMSO alone. It required some stronger therapies, not the least of which was lifestyle changes. So, Andrew Moulton was a Canadian neuroscientist and doctor specializing in neuropsychiatry. And during his clinical training, he noticed that young children exhibited subtle neurological signs of stroke that his colleagues missed. And over time, he found these strokes often occurred soon after vaccination and could lead to severe neurological disorders like autism. Now, we know that vaccine injury reports date all the way back to the early 1800s, even though the vaccine started showing up in the 1700s. Communication back then wasn't like today. You know, you could observe, you could walk out in front of your house and observe a giant sinkhole happening in the street in front of your house. And you grab your phone and you get a video of it and you upload it. And within an hour, it's got 1 million views. Well, we didn't have that back in the 1700s. We had the press and we had various societies, but it took a while for information to get around back then, especially information that would challenge the status quo. So the signs of vaccine injury back then are the same as reported today that were reported back then. And so Moulton realized that the subtle stroke signs that doctors look for in adults should also be looked for in children. And by the time I get through with this today, you're going to have plenty of things to look at in other people. You do not have to be medically trained to recognize something that's wrong. And mothers just seem to have an inborn sense of knowing when something's wrong, even more than dad. And because these strokes in infants are often missed, many conditions are misdiagnosed and they're attributed to some other kind of a cause. And so a major scientific challenge in making these invisible issues visible is a real trick. But in neurology, disruptions in brain function, often due to impaired blood flow, can reveal stroke locations through careful examination just outside examination of the human body. And this is one of the things I loved about my chiropractic education, was the neurology that was involved. Semester after semester after semester of deeper and deeper neurological understanding of how the nervous system rules and controls everything inside the human body. There's hardly anything that starts, there's hardly anything that stops without the immediate control of the nervous system behind it. And even when certain cascades begin as a part of, like the blood clotting feature, you get a little bit of a laceration, paper cut, or a knife cut, bigger, whatever. And what's involved in the cascade event from the signal that comes from the mast cell all the way to the formation of clots is still being regulated by the immune system. Everything going through digestion being regulated and controlled by the immune system. And just being able to maintain autonomic balance between the sympathetic and parasympathetic systems is immediately controlled by the immune or the nervous system. So when something happens to alter that normal neurological balance, a whole litany of diagnostic answers can show up, most of which are wrong, simply because they're focusing on the symptom rather than the cause of it. And because these kinds of strokes that I'm talking about that adults have, that children can get, they're usually misdiagnosed, but when you observe the child and do a couple of simple little neurological tests, you can usually locate where that stroke took place. So you remember that there are 12 cranial nerves that come out of the brainstem, out of the pons, out of the midbrain. And there are areas that have of the medulla that have less redundant blood supply than other critical parts of the nervous system. And the kind of strokes that are caused by impaired blood flow, often due to increased blood thickness, were missed in infants, leading to conditions misdiagnosed or attributed to some idiopathic or some unknown cause. And so the key cranial nerves, the 12 of them, remember the first one is just the olfactory, the ability to smell. The second one is the optic nerve, being able to see. But then there's 3 other nerves that have something to do with the eyes. Of the 12 cranial nerves, 3 of them have to do with the eye position. And, cranial nerve 6, start with that. It controls eye movement, and damage causes an inward eye or a jerky side-to-side movement. I think it's the lateral rectus, if I remember right, but I might be wrong on that. But cranial nerve number 6, so that when you look at somebody's eyes, they should be obviously looking straight forward in the same direction. And if they move their eyes left or right, there shouldn't be any jerky side-to-side movement. And when they're looking straight forward, both eyes should be looking straight forward. One of them, if it's turned in a little bit, then there's probably some damage in the cells, the nucleus origin of cranial nerve 6. What kind of damage? Where the child did not seem to have any kind of an accident, a fall, a spill, a car accident, whatever else, but all of a sudden they've got an eye turning in. And the lateral rectus, the one that pulls the eye outward, has become weakened for some reason. And the medial rectus that I think I got that, if I remember, I didn't look this up before I did the show, but I think I got the muscles right, becomes overpowering and it pulls the eye inward. Now, we've all seen people like that. Now, interestingly enough, according to Dr. Molden, cranial nerve number 6 is the nerve most frequently affected by COVID-19 injuries. But there's other post-vaccine injuries that involve cranial nerve number 6, the inward turning of the eye. There's cranial nerve number 7, the facial nerve, the kissing nerve, the smiling nerve. For you to be able to pucker your lips and kiss, that's cranial nerve 7. To smile and frown is cranial nerve number 7. This is the one that's damaged by Bell's palsy, where you get the drooping or the asymmetry of the structures of the face. Cranial nerve 7 is affected by this. We call it Bell's palsy. Wouldn't you know it? I can't. Hold on just a second. Don't go away. So You remember what happened to Justin Bieber. I think he's doing a little bit better now. But all of a sudden, he woke up one morning with his face looking like half of his face had melted, like candle wax. The nerve to that side of his face, cranial nerve number 7, became severely inflamed for whatever reason, and he lost muscle tone to the facial muscles. This quite often is the result of a vaccine injury. A lot of people that I've taken care of with Bell's palsy, and Bell's palsy, if it's caught early, responds very well to the treatment we offer in the office. If it's been there for a long time, it's hard for that to recover. The facial muscles will start to atrophy. And then it takes more therapy and treatment to get that to return to normal tone. But if we catch it early enough, then usually it has a very positive outcome. Then there's cranial nerve number 4. And that's what levels the eyes. Damage causes head tilting to compensate for uneven eye height. So we have an abounding pediatric practice in our clinic. And I see everyone from newborns all the way up through their teen years. And when a child comes in, sometimes parents will bring a child in because the head is tilting, and they don't like that. Well, the head's not supposed to tilt. If it's a result of some kind of an accident, a fall or injury or something, we can fix that head tilt really quick. But if it's a result of a vaccine injury that causes one eye to be a little bit lower in the socket than the other eye because of cranial nerve number 4 damage, the head will tilt to compensate for the eyes out of balance with one another. Now, while that's a marvelous compensation on the part of the central nervous system to account for something like that, it could leave the child with a head tilted the rest of its life. And so you look at the eyes. Is one eye drooping a little lower than the other eye? I have that. One of my eyes droops a little lower than the other eye. And I attribute that to vaccine damage as a child. Now, I don't hold anybody responsible for that, except the ignorant doctor who administered the vaccine, but they don't know any better because they don't study it. I guess there's reason there to get upset about it. But that's cranial nerve number 4. And these things can be assessed in a child just by looking at their face. Now, sometimes you'll see multiple cranial nerve injuries on the same face, which suggests that more parts of the brain have lost their blood supply, and hence there may be deeper neurological damage that's taken place. Because cranial nerve deficits have long been observed after vaccine injuries, especially in autistic children. Now, there's this case of triplets, all who received a hot pneumococcal vaccine. And in a few hours, every one of them had cranial nerves stop functioning, after which they became just rapidly, severely autistic, making it nearly irrefutable that that process caused autism. Now, once you know how easy it is for these kinds of symptoms, a loss of smooth eye motion, they're very easy to spot. And you will gradually become aware of how far-reaching the neurological damage resulting from vaccinations can be, since any part of the brain can be affected. And when you're dealing with the brainstem and the cranial nerves, boy, it just controls everything that's involved with maintaining the balance of life that the brain operates for you without you ever giving a second thought to it. Now, I'm not asking you to become diagnosticians, but the next time you're looking at a baby And the baby's eyes, of course, should be locked on you. And then you kind of move your hand around in front of their eyes. I know this can sound a little weird. You would only be doing this if you suspected something wrong somewhere. And the eyes should move steadily following your hand. You'll often see doctors doing this with children or adults. Look at my finger, follow my finger. Why is the doctor moving the finger around for you to watch? Because he's looking at eye movement. And the movement of eye comes out of the brainstem. So if he's suspecting some kind of a problem of a neurological order in the brainstem, it's going to show up in the eyes. Not always, but it very well could. Now, if you look at a lot older pictures, and I'm thinking of a lot older in the sense of Civil War, the 1860s, something prior to the 1880s, 1890s, when vaccines began to be a little more common. And you go back and you look at these pictures, and we usually dismiss these films because the people look so stoic, so emotionless. And they're usually not looking at the camera, they're looking off in another direction, but they may be looking at the camera. And we just kind of think, how odd. They're not smiling, they're not laughing, they don't look like they're having a good time, they look like they're being forced into the photo. That's because the pictures would take 30 seconds. And so they would be told, don't move, don't smile, don't laugh, look at the camera, don't move. And the lens would be open for as much as 30 seconds or longer in some cases. And then they would close the shutter, and then they would go to develop the picture. And here you have all of these very stoic looking faces. If you have an opportunity to look at some of this stuff, and you can Google it, you can go to Google and bring up images of older pictures, of people. Look at the eyes. Very rarely will you ever see facial asymmetry. Very rarely will you see in any of these pictures one side of the face looking different than the other side, one eye looking different than the other eye. Very rarely will you ever see that because their nervous systems weren't poisoned. In Dr. Molden's article, he talks about looking at the walls of medical school class portraits and noticing how their faces changed over the decades. Wow, that's a big one. When you look at, now, looking at picture, in fact, I have some pictures here in front of me of some well-known Hollywood stars. And there's all kinds of asymmetry in their facial structures, in their eyes. But if you're not looking for that, you probably won't see it. But boy, when you see it everywhere. I remember when I was still in school, let me give you a little story aside to point out what I'm talking about. I remember when we, through the process of learning how the body works, especially in the sense of the neuromuscular system, how the nervous system controls the muscles of the body, and signs and symptoms of some dysfunction in the neurological control of the muscles that would allow for shoulders out of balance, hips out of balance, the head and neck leaning off to one side, twisting of the body framework, things like this that are everywhere you look, but you won't see it unless you're looking for it. So when I began to see these things, and I could see it in some of the students at school, whenever we would have to drive all the way across Davenport from where we lived in Bettendorf to go to church on the far northwest side of Davenport. And there wasn't a freeway. There wasn't a quick way around town. You had to drive through town to get there. And this is back in the days when you could make a telephone call for 10 cents. And people rode buses more than they do today. And so whenever we would go past a bus stop and I would see somebody standing there, I would point it out to the kids that were in the car. I said, look at that poor lady. Look at her head relative to her shoulders. Or look at how that person's walking. Well, it got to the point where they finally said, Dad, would you shut up? We don't care. This may be important to you, Dad, but it's not important to us. Now, they didn't have iPhones. They didn't have iPads. They didn't have some kind of device holding into their hands that would isolate them away from the immediate reality of the moment. They were either reading something or still asleep, trying to catch up on sleep because church was early. But they didn't like me constantly interrupting them, pointing these things out. But interestingly enough, before graduation, there were times when we would be driving through town to get to church, and they would start to point it out because I taught them how to see it. Now, the reason I'm getting into all of this is because we miss an awful lot of obvious symptoms of vaccine damage that's right in front of us because we don't know where to see it or how to look for it. We just know, oh, he has lazy eye. So the ophthalmologist, the pediatric ophthalmologist, is trying to come up with a particular lens design, or the optometrist, to be able to help the lazy eye. Well, why is the eye lazy? You're not supposed to have a lazy eye. But they dare not mention it could be neurological damage brought on by a microstroke in that area of the midbrain or the pons where that nerve originates. Now, Molden's work suggested strokes were occurring in other watershed areas of the body, such as the internal organs or speech centers. Look at Bobby Kennedy Jr. What's causing that dysphonia? He's not sure himself. I don't know what's causing it, but I know some people who blame it on the vaccines. When you've seen, and I started practice in 1995, I've seen over probably 21 to almost 22,000 people in that period of time. You see trends and you hear stories. And when a mother tells me something about their child, I'll listen to it. Because nobody knows that child better than mom does, even better than dad. Well, of course, there's some exceptions to that, but for the most part, nobody sees changes in their child like mama sees them. And so when they come in and they say, he's not breathing the way he used to breathe. What do you mean? Well, it's like he's having a hard time catching his breath. Well, is he involved in sports? Or, do you have stairs in the house? No, there's nothing like that. Just every now and then he'll have a hard time catching his breath. And then I have to ask the question I never, ever want to ask, but I have to ask it. Is he up to date on his vaccinations? More often than not, yes. Not always, but more often than not. So autopsy studies on children who died from organ failure show strokes in the internal organs of children with congenital rubella. Where did they get rubella? Maybe mom had it, and they got it through the placenta. Maybe they got it from an MMR. We don't have the research, one way or the other, to pin that down, but it's a possibility. Similar disease processes in teenagers and adults after an HPV or an anthrax vaccination. two particularly harmful vaccines. HPV has been in the news quite a bit lately because they're having to shell out damage remuneration. And one of the most striking examples was of children of soldiers, the soldiers who had received the anthrax vaccine, children born without limbs. Remember, thalidomide was notorious for doing this. And why? Because thalidomide, while it made mom get through pregnancy easier, it blocked the formation of new blood vessels. In a developing baby inside the womb. Part of the explosive growth that takes place is the tens of thousands of miles of blood vessels. The average adult today, and the average adult is considered 160 pounds at 5'8". That's what's considered average. Has 60,000 miles of blood vessels. That's 2.5 times practically around the earth. The majority of which are invisible except under a microscope, the tiny little capillaries. And what they found out about thalidomide is it blocked the formation in developing babies of these arteries. And if you're trying to grow arms, you need the arteries and the blood vessels that carry the nutrition and the growth factor to this genetic nest waiting to create an arm. So Life magazine did this publication, The Tiny Victims of Desert Storm. It was some time ago. You can Google that. The Tiny Victims of Desert Storm. The little children born without arms and leg problems of fathers who had the anthrax vaccine. How in the world did that get into the baby? Did it affect the sperm cells of dad? Neurodegenerative processes in the elderly and psychiatric disorders are being linked to detectable cranial nerve damage. A major issue in conventional medicine is the failure to recognize neurological damages that can lead to psychiatric issues. Can there be neurological damage that contributes to dementia, especially the Alzheimer's variety? What's causing the beta amyloid plaquing that takes place in an Alzheimer's brain? Well, there's conjecture about it. They're still looking into this kind of stuff. They have drugs that, if it's caught early enough, seems to slow the formation of the beta amyloid plaque. But where's that coming from? What's the body going through that it would develop that mechanism to create that kind of plaquing? Was that caused by vaccines? We don't know. We don't have the research. We have a lot of conjecture on the subject. I got 3 vaccines as a child back in the 50s, 1950s. And that's all I've ever had. I've mentioned before, when I was about 12 years old at the junior high, my family lined up for the oral polio. I'm not worried about that one, because by the time it went through my stomach acid, it was pretty well destroyed. That's why they don't do much of that anymore. But recognizing the neurological damage that can precede psychiatric issues is vital, because emotional changes in patients with nervous system injuries are often misattributed as the cause rather than the symptom of the illness. You know, all of us said, "Hey, Dad, he was never depressed. All of a sudden, he's feeling great depression. He has everything. He has a great retirement. He doesn't have to worry about money. Mom is there taking care of him as she always has, but suddenly he's falling into a depressive state." Well, did he get the COVID vaccine? That may not be a fair question, but it's on my mind as it is on a lot of other minds, because we know the COVID vaccine causes blood clumping. Blood clumping will slow down blood through the capillary beds, robbing whatever area this is taking place in of vital oxygen and nutrition to that part of the central nervous system. And there's a lot of your central nervous system that actually originates in the cord. The sympathetic nervous system doesn't originate in the brain. It originates in the cord, interestingly enough. So a little microclotting that can take place in the cord can affect the sympathetic aspect of your autonomic system, which is the fight or flight, that in certain instances needs to be triggered. But if it can't be triggered and the parasympathetic rules and dominates, where suddenly dad doesn't, he's not the same man anymore. Well, the first question out of my mind, did he get the COVID vaccine? Is that proof of anything? No, it's not proof of anything. As they say, causality isn't, or correlation is not causality. But then Molden began exploring the universal response was causing microstrokes and how they could be treated. And he produced some videos on it. Unfortunately, shortly before releasing a second series on the solutions for these injuries, he died under very suspicious circumstances. But we still have a lot of clues as to what he had discovered. Number one was blood sludging. In the medical world, a long-standing puzzle revolves around how small insults to the body can lead widespread illness or even death. You know, it's like an elderly person suffering from osteoporosis, and they turn or twist in such a way that the femoral head and the femoral neck at the top of the femur snaps, and then they fall down. And they're diagnosed with a broken hip as a result of the fall, when in fact the fall was the result of a snap in the femoral neck that prevented them from standing up and they fell down. And so they go into the hospital and they either get a total hip replacement, or they find out they can use some pins or some other, some titanium straps or whatever, and are able to screw the hip back together. And so that it was stronger than it was before it fractured. And with some physical therapy, they're back on their feet, walking around. They might need a cane. They might need a walker, but they're back up on their feet walking around. But shortly thereafter, they start having some serious breathing lung problems. Or they have some liver problems or kidney problems, and within 2 months, they're dead. Because that fracture caused a serious enough problem in the circulation system that other parts of the body began to be robbed of nutrition. Now, this is more common than you would otherwise suspect as taking place inside the body. Melvin Nisley, PhD in the mid-20th century, made some critical discoveries about this kind of phenomenon where following some kind of an injury, and sometimes a small injury, you know, you're racing down the stairs, carpeted stairs, your foot goes out from underneath you and you land on your butt and it hurts, it's bruised, but nothing's broken and you're back up and running around. What he found, particularly with malaria-infected monkeys, what's that got to do with slipping on the stairs? That certain severe illnesses could trigger significant blood sludging, starting in small vessels and eventually spreading to larger ones, which would become typically fatal unless they were given with an anticoagulant like heparin right away. And this thickening of the blood is like a massive traffic jam, disrupting the body's natural blood flow and leading to gridlock of the circulatory system, which leads to death. I have been to Europe a number of times, and I've never seen traffic problems in London or Paris or Frankfurt or Rome for the most part, being moved, transported by cabbies. Traffic moves pretty good. But Cairo was another story. Oh my goodness. It was the craziest thing in the world. And while we were being transported from the hotel to the Cairo Museum, there were 6 lanes of traffic that we were moving along pretty good in, and all of a sudden it slowed and slowed and then came to a dead stop. Those 6 lanes came down to 2 lanes, right there in the middle of town. And you kind of scratch your head, and why don't they do something about this? Well, they're not going to do anything about it because that's not their culture. And I remember looking out the window of the van that we were in. One of those 6 lanes off to the right had a young boy on a donkey cart being pulled by a donkey, and the cart was loaded 10 feet high of sugarcane. And out to the left of the van that we were in was a high-end BMW, and with dark windows. I mean, you could not see inside the car, but you could tell that it probably had a limo driver because it looked like a BMW limo, not the big long one, but more than just, an X5 or something pretty big. And there was that contrast in downtown Cairo traffic. And so whenever I start reading about blood clumping and some kind of a situation where you get gridlock of circulation inside the body that leads to death, because that gridlock could be in where the internal carotids or the posterior vertebral arteries bringing blood to the brain get blocked by blood sludge. What's the death certificate say? Stroke. But what caused it? Well, sometimes they're not so quick to look into that because of what they might find. Now, additionally, Dr. Molden discovered that this systemic sludging could be seen externally through the eyes, providing this non-invasive way to assess this process throughout the body. And for this, he discovered that the greatest blood sludging was seen in critically ill hospital patients. Something Pierre Kory, K-O-R-Y, MD, observed with point-of-care ultrasound, as once microclots within the carotids became what's called echogenic, visible on ultrasound. Patients would die shortly after that, not because of the test, but because of what he saw. And likewise, multiple ultrasound researchers' results showed blood sludging with their patients. Now, after learning of this, there were those who tried to replicate his microscope and have been able to see some sludging that he observed in his records 80 years ago. Well, this concept exists in other medical systems. Chinese medicine, for example. When the smallpox vaccine was released, the Chinese medicine has come to view blood stasis as the primary cause of illness. And much of their blood stasis framework directly overlaps with blood sludging models. Blood sludging is frequently observed in burns, which is one reason why DMSO is so helpful for burns. So, how far do I want to go with this? Because I can get a lot deeper here, but I don't think I want to do that. I'm trying to point out certain dangers that involve when you alter the body's natural defensive mechanisms. And more people are waking up to the dangers of vaccines. I've only covered one small area, microclotting. And if it occurs in the brainstem, you can see it in the face of the patient who's suffering from it, even though they may not be aware of it. A lot of times they don't know. I wanted to point out on the morning or evening news, the personalities that are involved with morning, news, weather, sports, special reports, whatever else. Same thing in the evening, news, weather reports, sports. Certain personalities will stay there in a fixed position for maybe as much as 20, 30 seconds, giving some report on what the local basketball NBA team did, or the hockey team, or college football teams, or local high school sports teams. Look at the face when it's staring right at you. And as Goethe said, we only see what we're looking for, and we only look for what we know. I'm telling you to look beyond what you know. Watch those faces. And if you want to try something really scary, this can shake you to the foundation of your own consciousness. Go into the bathroom, shut the door. Don't look in the mirror. Square yourself to the mirror, what feels like squared, like you're looking directly at the mirror. But don't look at the mirror yet. Look down or have your eyes closed or whatever else, and stand directly in front of the mirror. And then be willing to open your eyes, but don't move a hair after you open your eyes. And look at yourself. Don't try to correct it, because your left brain will try to correct what it thinks is wrong, because your left brain is in charge. Your left brain is the one that's driving the truck, and it's in control. It's got its hands on the steering wheel, and will try to bypass that voice in the back of your head by correcting what it perceives might be a problem without it ever being a problem. So before you open your eyes, you are fixed, and you're not going to move a hair. Now open your eyes. Is one eye lower than the other one? Is there any tipping of your head on top of your neck? Are your pupils completely level with each other? Look at the earlobes. The earlobes can vary a little bit, but not that much. The earlobes should be very level with one another. Your pupils should be level. Your eyebrows should be level. And your cheeks should be symmetrical from one side to the other. And your head should not be tipping. Now, the misalignment of the spine that I address can easily cause those things to happen. But it may be something else. What are you going to do about it? Because if you're one of those, and I've had other people do this, if you're one of those people who do this for the first time, you can get a little panicky. Don't get panicky. I'm just trying to point out there may be some neurological damage. What caused it? I don't know. I don't know your history. Was it vaccine earlier in your life? I don't know. Was it some medication that you've taken for whatever reason? Was it too many antibiotics? I don't know. But the fact is that it's there. And it's not normal for your head to be tipping. It's not normal for one eyelid to be a little lower than the other eyelid. It's not normal for your eyes to not be focused in exactly the same direction. It's not normal for one cheek to look a little different than the other cheek. And the corners of the mouth, when I talked about watching personalities that you're familiar with, you've got your favorite weatherman, woman, you've got your favorite sportscaster, whatever, and you make sure that you turn the TV on in time to catch the report you're looking for. Look at the corners of their mouth. They should be perfectly horizontal, parallel to the surface of the earth. If one side of the mouth is a little lower than the other side, I guarantee you that's vaccine damage affecting the facial nerve. What are you going to do about it? So what, Jack? So what? It doesn't hurt. They don't have any complaints. Well, you might want to do something about it because there are things that can be done about it in the sense of restoration of the nervous system and nervous function. Oh, it's after the first hour. I've gone on this longer than I planned on it because one thing that I wanted to get into was how to feel better in 30 days. There's an awful lot more of this information I could have gone through. But let me just conclude here, this talking about vaccine damage. I am not a vaccinologist. I do not make vaccines. I'm not a pediatrician. I am not an internist. I am not a medical neurologist. But I have studied these subjects endlessly and will hold my own with any of those with medical training in those areas, as a lot of you can, because you study. You're not content to just swallow what somebody else has to tell you about your brain or your heart or your liver or your ovary. You want to look into it yourself, because the medical industry is based on drugs. They're not based on vitality and recovery and rebuilding. They're based on getting rid of the bad symptoms and trying to keep them at a minimum. But that only happens if you're on that drug. You stop the drug, then the symptom returns. That's not restoration. That's maintaining. What we are about in our clinic is restoration, and we start with structure in the nervous system. I want to give you one example of this lady I saw yesterday for the first time, 80 years old. She came in because of the half special. The half special is still going. She came, but it should be scheduled. It should be scheduled for February, but it should be scheduled before the end of January. The schedule should be made before the end of January for me to see you in February. I know that they're already scheduling March because of this special. I only was going to do it till the end of December, but there's been so much demand for it. I don't want to turn these people away. So the half thing's still going. So this lady, 80 years old, comes in yesterday. It's one of these people that flop back and forth, standing upright, but flopping off to the left, then to the right, to the left with each step they take. Because severe left hip pain and left lower back pain, and her knee right knee that was replaced 10 years ago is still causing, after 10 years, pain. And she was brought in by her daughter. And I've been working on the daughter's, one of her children who came home early from a mission because of migraines. And we are helping that to change drastically to get him back out in the mission field, which is what he wants to do. But when she saw what happened to her son, she brought in her mother. She's like, so when someone walks into your office like this at 80, and they're all excited because they heard of the great miracles, and I'm sitting there thinking, oh, I don't know about this one. I don't know about this one. And so I get a history, and she's been hurting her whole life. Bad accident early in life. And it's right there in the x-ray. There's few places on this planet where you can go and get the absolute unmitigated truth. X-rays are one of them. X-rays don't lie. They have no religious belief. They have no political persuasion. They are what they are. And right there on the x-ray, I said, look at this. Look at this spurring. You used to have discs here. There's no discs there. And look how this bone is shaped. It takes an entire lifetime to do this to a neck. Am I beyond hope? No, not at all. Just this is baseline. This is where I start. This is where you're at. I can't change the shape of that bone, but I can certainly get rid of the pain that's associated with it. So I take the full films, do an analysis, and I work on her. And it took a while, but she gets up and she starts walking around and she's not flopping back and forth right to left. And she goes out and walks out in the waiting area and turns around and walks back into the treatment room. And she's standing up straight. I said, "Do you know you're standing up straight?" She said, "Yes." I said, "Do you feel taller?" "Yes, I feel taller." "That's because your spine just straightened up. I got rid of the problem that was causing your spine to bend and twist. That's all. It's like a switch. I turned off the switch that was causing those muscles for the last 6 decades to be in spasm. And that's where your pain was coming from. It wasn't a hip. It wasn't arthritis. It wasn't torn labrum. You simply had muscles down there that won't relax. Now they're relaxing because the signal to tell them to spasm stopped. Well, they have a hard time understanding that. To me, it's child's play because this is what we do day in and day out. But it was hard for her to understand this because she's never seen it before, but she felt it. And she's almost as giddy as a child on Christmas morning. I said, "How's that knee feel?" "Oh, it's much, much better." Well, I changed how she's walking on the knee. I didn't touch the knee, but I changed how she's walking on it. And so the pain, the inflammation has already started to subside. That's the kind of work we do. I just wanted to throw that in there because we still have a few spots left for half price. And I just love taking care of people like this. I really do. I think before the week is over with, I've got 4 more new patients scheduled who are coming in because of the half price. They would not have come in at full price. And the interesting thing is, when a lot of these people, once I get through taking care of them, I said, "Do you feel that what you're paying is worth it?" "Oh my goodness, I would have paid more if I knew this is what I was going to get." Well, like many things in life, we shop by money. And unfortunately, when it comes to health or the health of our children, we shop by money, not by quality of treatment or quality of care. We shop by how much it costs and where can we cut dollars in order to get what we think is going to be relief by paying the cheapest amount of money we can get. We wouldn't do that to our cars. We don't do that to our pets. It's interesting we would do it with our own body. Anyway, I just wanted to mention that about this lady. I will see her Friday for a follow-up. And I told her I'm going to see you once a week for 2, maybe 3 weeks. And you're going to be 75 to 90% better by the 3rd time I've seen you. You're not okay. You're not well. You're not, you're just on a way to recovery and stability. And it was a pleasure to have taken care of you. Now, let me get back to concluding about vaccines. The research is overwhelming. Lifetimes of reading on all the research that's coming out, mostly from other countries, mind you, where they have to pay for the damages of vaccine injuries. We don't do that in this country because vaccine companies here aren't held responsible for vaccine damages. 1986. Thank you, Ronald Reagan. But what do we know? We know that vaccines consistently cause harm. And there's so much variability in vaccine injuries that it's sometimes, unless you are really attuned to this, it's hard to relate that injury to the vaccine. But the damage is cumulative, as is impairment, as is the impairment of microcirculation and other fluid circulation, the lymph, the flow, the movement of lymph in the body. Oh, you're right. I didn't give the phone number. 801-523-1890 to make an appointment for a consultation. You'll be scheduled for an hour or so after that for me to take care of you, but if you decide you don't want me to take care of you, we'll shake hands, we'll still be friends, and you can go on your way at no charge. As I said, vaccine damage is cumulative as existing impairment of the microcirculation will just get worse, and lymph can be involved as well. And a lot of infectious diseases can sometimes cause similar, but not as severe as vaccines, similar damage. So the damage that you're observing may be caused by some infectious disease and not a vaccine. So it's not all that easy to tell the difference. But usually something like Bell's palsy will happen within 2 to 3 months of a vaccine. Once you know what to look for, I mean, it is really eye-opening how many different illnesses result from fluid stagnation within the body and how much hospital care could be improved by monitoring this stuff. Now, in Chinese medicine, the first indication that something is wrong is the flow of qi, energy. This is one of the things that acupuncture is involved with in order to improve the flow of energy throughout the body. You know, and it's incontrovertibly true, that we are electrical beings and we have electrical charges moving through the body all the time. In fact, that the action potential is what causes a nerve to fire. Electrical potential. So with billions of synapses going on in my body all the time right now, there are billions of electrical charges being raised, released, raised, released. The action potential, build up the potential, fire, build up the potential, fire. Well, we have within our body pathways for this nerve energy. And the Chinese, thousands of years ago, tracked this whole thing out, which Chinese medicine and Chinese acupuncture is focused on. I never had any acupuncture done on me. It just didn't register on my radar screen until I had an injury in my left shoulder because of overdoing some weight training. And it was terrible. I mean, the pain, and chiropractic would get me to a point, 75, 80% relief, but there was 20% in there that was still terribly painful. So Trudy, who works with me in the office, has an acupuncturist that she goes to. And she kept telling me, you got to go see Dr. Stevens. You got to go see, yeah, you got to go. I don't know how many times she told me to do it, till I finally decided to do it to get her off my back. You know, it's like the parable of the king and the woman that is begging the king for bread, keeps banging on the king's door. I need some food. I need some food. And he finally gets up, not out of some compassionate move to help this hungered woman satisfy her hunger, but to shut her up. So, okay, Trudy, I'll go. So I went 3 times. And each time there were needles in my armpit, there were needles in my head, there were needles in my feet, and I think in my groin as I laid there. And some of these needles hurt, and especially the ones in my armpit. I went 3 weeks, or I don't know if it was 1 week or 2 weeks between visits. But after the third one, the pain in my shoulder was completely gone. Has never been back. Never been back. So that compelled me to study it a little bit more. The energy flow through the body that the Chinese mapped out. And if you've ever seen an authentic Chinese acupuncture map, it's fascinating because there's over 600 contact points on the human body to address the flow of energy called qi. Now, I said all that to say this. The second stage of disease in a patient from Chinese medicine perspective is blood flow. Just what I've been talking about for the last hour and 20 minutes. Blood flow. The Chinese recognized that blood flow, the pooling of blood, the clumping of blood, would lead to the next stage of sickness, which was the beginning of apparent diseases. And so what they would do is provide herbs and other modalities to restore normal blood flow throughout the body. And if they would do that, chi would be restored. And if chi came back to balance, you'd live a long, healthy, happy life. I think that's beautiful. But it was interesting to me when I was doing a study of Dr. Molden's work, who died under very suspicious circumstances, mind you, that it fell right in line with Chinese medicine. All right. Now, what I want to get into is a little bit, as I titled this talk today, how to look better and feel better in 30 days with your blood clumping. It's something that I'm doing right now. You have to admit, those of you who are on the stream, I keep looking younger all the time. In my morning ritual of supplements that I take, and except for the magnesium citrate, what else? There's a couple other things. They're whole food based. There's nothing synthetic in there. As you read the label, they come from herbs, and they come from plants, or they come from animals, extracts of various tissues in an animal. That triggers the growth of that particular tissue in this animal that I am. I'm a mammal. Mammalian derived growth factor extracts will cause improved growth of that tissue in any mammal. So one thing I definitely take is flax oil. And I've talked about this on the program before in the past. Flax oil contains all the essential amino acids, which are the building blocks of proteins. And it's a very rich source of vitamins A, B1, B2, C, D, E. It contains all the major minerals, including potassium, phosphorus, magnesium, calcium, sulfur, iron, zinc, as well as some of the important trace minerals like manganese that your ligaments need, silicon, copper, nickel, cobalt. Yes, cobalt. Cobalt is the basis of vitamin B12. Iodine, chromium, selenium that your heart needs. And these oils, these flax oils, they're called linseeds, are an excellent source of fiber and mucilage. Mucilage is that gelatin-like substance that serves to smooth mucous membranes all along the digestive and intestinal tract. But most important, flax oil is a supreme source of essential fatty acids. Now, the essential fatty acids, known as EFAs, are linoleic acid, which is 3, and linoleic acid, which is 6, omega-6, omega-3. They're also known as vitamin F. I've often referred to that because they were identified as vitamin F decades ago. As I've said before, vitamins got their designation by a letter in the chronological order in which they were discovered. Well, they don't call it vitamin A. I still call it vitamin F. But they don't call it, the FDA doesn't call it anymore because they're essential fatty acids. They refer to them as fats, as EFAs, which is fine. It's the same stuff. And they serve to help control cholesterol levels and prevent cardiovascular disease. The research is overwhelming. And they play a major role in transporting oxygen to every cell of your body. And by virtue of the electromagnetic charge on EFAs, they aid in detoxifying the intestinal tract, the kidneys, the liver, the lungs, the skin. And essential fatty acids, and some of you take fish oil. You want to be careful where that fish oil comes from, just as you want to be careful where the flax oil comes from. I, of course, use Standard Processes flax oil. I've talked about this in the past. There are a lot of people who come into the office to pick up a bottle of these. I take 4 of them every morning. I do not miss that. I don't always take every one of my supplements every morning. Sometimes in the morning, I just look at it and I think, I'm going to take what my brain needs. I'm going to take what my heart needs. And I'm going to take a break. And then tomorrow I'll get back into the full protocol. But I always take my flaxseed. They play a major role in controlling chromosomes during cell division. And they are absolutely necessary in the development of new cells and the formation of the membrane that surrounds that new cell. And since cancer cells are simply abnormal cells, you can see how EFAs would play a major role in preventing cancer. Now, I'm not allowed to say that flax oil prevents anything, but the research says it, not me. EFAs are supremely important in production of prostaglandins. These hormone-like substances control blood pressure, heart function, sexual and reproductive function, and an awful lot more than that. And when you get a deficiency of if you have a deficiency existing in your body of EFAs, the fine balance of the many types of prostaglandins is thrown off, which can result in degenerative diseases, premenstrual syndrome, prostate trouble, not to mention some serious neurological problems. In fact, a deficiency of EFAs, which is usually coupled with excessive intake of saturated and chemically altered fats from the crazy 8, the deadly 8 oils, leads directly to what has become known as the killer diseases, especially cancer and heart disease right along with it. So deficiencies of these essential fatty acids, which I take, as I said, 4 flax oils every morning, have been linked to arthritis, psychological problems, liver, kidney damage, poor circulation, poor vision, hair loss, skin diseases, severe weakness, dryness of the mucous membranes, and menstrual and reproductive problems. Now, just after I get through spending almost an hour and a half talking to you about vaccine damage, I'm talking about how deficiency of a very important food ingredient that Mother Nature made can manifest with similar symptoms of vaccine damage. Because I know there's 1 or 2 of you out there that after I went through all those damages involved with vaccines, and you haven't had any vaccines, but you might be having some of those symptoms. Aha, Jack, how do you explain that? Deficiency of essential fatty acids. We did 2 heart sound recorders yesterday on 2 very fine people. A good fellow and his sister. And it was their first one. And the sister is 80 and he is, I think, a little younger than me. But in apparently good shape. Stands up straight, moves around, doesn't look like he has any kind of structural problems. But his heart's weak. And we pointed it out on the exam. And his sister's heart was even worse. And I asked her, I said, what's the largest killer in America? What one particular thing kills more people in America than anything else? And she knew it was heart disease. She tried to say cancer or heart disease. I said, yeah, in some parts of the country, cancer is now ahead of heart disease. But for the most part in our country, and for Western civilization as a whole, because we eat pretty much the same foods, heart disease is number one. And I said, who stands as the vanguards to try to deal with heart disease in this country? And she knew it was cardiologists. And then I say a very nasty thing. Why would you trust anything they had to say? If they're the ones standing there monitoring, taking care of the number one killer in America, why would you listen to what they had to say to you? Now, before they think I'm anti-medical, I come right back in and I say, listen, if I think I'm having a heart attack, I'm going straight to the nearest emergency room I can find to get modern health care to intervene in me having a heart attack. There's no issue about it. And I'm going to do exactly what they say. There's no issue about, as much as I understand heart chemistry, I still am going to do what they tell me to do because they have the power to save my life. A whole bunch of vitamins is not going to stop a heart attack. But they have the power to do that. So I have no problem with that. The problem comes in after they save my life and we assess the damage that's been done. What are you going to do about it now? Well, here, metoprolol, slow that heart down because it's going to be going like crazy. And then you probably have some beta adrenergic drugs and some calcium channel blockers and whatever else. There may be some AFib going on. There may be a bunch of different things for which there are drugs to control those things. But those drugs do not address the issue as to why it happened in the first place. In other words, you didn't have a heart attack because you didn't have a pacemaker. You didn't have a heart attack because you didn't have half a dozen different drugs flowing through your bloodstream at the time you had the heart attack. And I said, you had the heart attack 99 times out of 100 because of malnutrition. Pure and simple. How do I know that? And she's looking at me, studiously when I say that. How can I say that? How do I know that? Because heart disease hasn't been around that long. The level of heart disease we have now has only been around since World War II. And it gets worse every year, except there's been a couple of dips. And you know when those dips showed up? When people started running, when it got really popular to jog, when it got really popular to watch the kinds of oils and fats that you eat, and when people started cleaning up their diet of junk crap, there was a little temporary drop in the incidence of cardiovascular disease. So I said, you can get on your computer and go to cdc.gov and go back to the census of 1910, and not the census, but they have a list of the top 10 diseases decade by decade. And you look at 1910. The number one cause of death, accidental death. The 10th cause of death was heart disease. Cancer wasn't even mentioned in the top 10. And if you go to 1900, 10 years earlier, heart disease is not in the top 10. What happened that it became the number one killer in America? Malnutrition brought on by, there's two branches of malnutrition. Not getting what you need and getting too much of what you shouldn't have. And when you combine starvation with toxic poisoning, you're a dead duck. You'll be lucky to see 80 years old. So, I'm trying to be gentle with her and talk to her about these things. I again caution her, I'm not a cardiologist. But I said, I'll hold my own with any cardiologist you want to bring in here. And we can talk about the heart. Because they have no training in nutrition. They don't understand the difference between vitamin E and vitamin E2. They don't understand the difference between linoleic and linoic acids. They don't understand the difference. They probably may believe fish oil is good for you, but they can't tell you why. No offense to them. I'm not judging them at all. What I'm saying is we've created that. We've demanded that from modern medicine. We want a pill. We don't want to change our lifestyle. We don't want to eat better. We don't want to sleep better. We don't want to change the emotional vampires we hang around with. We want life as we've enjoyed it up to this point. We want that morning donut with our morning coffee with artificial sweetener. Just give me a pill to get me through this. And that's kind of how our society is based. And, you can't argue that. So she said, well, what do I do? Well, there's these 3 things that I want you to take. And they're food. One of them stops the inflammatory attack on the heart. Great research behind that. The other one helps to take the chemical energy in the food that you're eating and converting it to electrical energy so you have a real strong spark coming down from the AV and the SA nodes of the heart, down the septum, into the ventricles to make sure it's lubbed up, not lubbed up, lubbed up, like slamming a door. That's how that heart should beat, and you should not be able to feel it. And the third one is a lot of extracts, animal extracts from heart that generate better heart function and heart strength. And I said, I guarantee you, in 60 days, if you will follow this religiously, in 60 days, come back in here for a second test, and you will see in front of you a different heart scan. But not just what you can see with your eyes. Within the 2 to 3 weeks, you'll feel better. Less lightheadedness when you stand up. More strength, less fatigue. Now, there are conditions in the heart, like advanced AFib. Those are a lot harder to fix. But general heart weakness, child's play. And essential fatty acids is an important part of it. Did I tell her to take flax oil? No. I'll probably tell her that next time I see her. But the things that I suggested, these 3 things, is what she needs the most right now based on the heart scan. I can see the weakness in the muscle. I can see what indicates stenosis and what indicates regurgitation of the valves. Now, I'm not allowed to say that because I'm not a cardiologist. But it's there. So we're doing more and more of these heart scans all the time. And it's just amazing. Occasionally, we will do a heart scan on somebody who's really fit. Fit in the apparent fitness state, not internal fitness. They just look fit. If I were to ask you, to describe to me somebody who's fit, what's the first thing you're going to say? Thin. They don't have any fat. They're thin. What else? How else would you? Muscles. No belly. They have a head of hair. They jog, or they work out, or they hike. Those are all outward signs, that's true. Give me some inward signs of somebody that's fit. And they kind of get lost with that question. Well, blood work. Yeah, we can send you out and get some labs. That's true. Do you know you could be suffering from a terrible disease and your blood work looks good? That's why sometimes they'll come back and say, well, we're not really sure what's wrong here because your labs look good. And you're sitting there, your x-rays look good, the MRI looks good, the blood tests look good, The echocardiogram could be better, but looks good. So we're going to watch it for 6 months. Come back in 6 months and see what's going on. Was there dietary intervention suggested? Was there nutritional support suggested? If you have a good doctor, yeah. If you have a doctor that's in the system and doesn't want to break out of it, you probably didn't get any. Again, I'm going to mention what I mention almost every week. Bobby Kennedy telling the medical schools, if you don't start teaching nutrition, we're going to withhold funding. Now, why would a non-medical doctor in charge of health and human services say such an outrageous thing? So I told her, I said, I can sugarcoat this and tell you, hey, your heart's still beating, you're fine. Keep eating those Twinkies. But I can tell you the truth. Your heart's burning out. If you want it to beat for another 10 years, this is what I suggest you do. And she committed to it. And we're going to see her in 2 months. And I said, I absolutely guarantee you do this religiously every day for 60 days. You not only will start feeling better in 2 to 3 weeks, you'll see a major change in your heart scan. Now, what did that have to do with you describing what a fit person looks like? Because I love doing a heart scan on somebody who thinks they're fit. And it is weak beyond belief. Half the people who drop dead from a heart attack are thin. Half of them. Because being fat isn't the cause of heart disease. Being fat is a side effect of something that causes heart disease. The major cause of heart disease simply is malnutrition. The heart getting too much of what it doesn't need and shouldn't have, and not enough of what it should have and doesn't get. Those two things right there will make you fat, make you lose your hair, make your skin look like hell, give you premenstrual syndrome, an emotional upset, anxiety, depression. All these things, usually the result of the body not getting vital micronutrition that it needs for the brain to work effectively, let alone the blood pooling that can result, not just from vaccines. So I know I've been getting out into the weeds here a bit, but this is vitally important. Now, I'm always asked, what diet is best? Anything ketogenic, anything that produces ketones. And the only way you can do that, anything maybe, that may not be the right word, but almost anything that's ketogenic that produces ketones. And the only way you're going to produce ketones is to cut back on the stuff that causes your insulin to rise. Carbohydrates, primarily processed carbohydrates. The kind of carbohydrates that at one time look like food, but they're not really food anymore. They've been altered. I tell them, if Mother Nature didn't make what you're about to put in your mouth, don't put it in your mouth. Except on occasion. I'm not going to tell somebody they can't occasionally have a piece of banana cream pie. It's just dessert at every meal is not the best idea. I love banana cream pie, but I can't remember the last time I had a piece of it. It's been a while. I love pumpkin pie. I love peach pie. Warm or hot peach pie with a nice scoop of ice cream on top of it. I can't remember the last time I had that, but I'll have it occasionally. But in the meantime, man, I load myself up with these supplements every morning. And flax oil is the first thing that I take. I don't know why I do that. I get into a habit of that. But I put all that stuff into a bowl, and I sit down there with my herbal tea, watching the sports, the latest sports reports, and the weather. I'm kind of addicted that way. And I reach in that bowl and I take my 4 flax oils first. For some reason, I just want that sitting at the bottom. So when those little pearls open up and that oil's released, all the other stuff I take on top of it gets mixed with that oil because it's fat. And a lot of the stuff I'm taking is fat soluble. So I want it to be dissolving in that flaxseed oil before it gets out of my stomach. Is there any therapeutic truth to that? I have no idea. It's just one of my compulsions. Now, without a doubt, the very best source of the essential fatty acids, linoleic and linolenic, is flax oil, even better than fish oil. Flax oil is close to 60% linolenic and 20% linoleic. And by nature's perfect design, flax oil contains the very vitamins that are needed to efficiently process and digest these essential fatty acids. It's interesting, the enzymes that exist in an apple, that Mother Nature, when she made an apple, made sure that the enzymes inside the flesh of the apple were abundant enough to digest the skin. Because the skin of the apple is where the nutrition is. And the same thing with almost every other vegetable or fruit she made. That those things contain within them the enzymes to break down the essential concentrated nutritional packet that exists in that food. That's why you got to be careful with the stuff that you buy. That's why I always recommend organic that hasn't been sprayed, but even some of that is the victim of overspray from surrounding farms. So you need to wash them. And then they've got these cleansers that you can spray on your vegetables and your fruit, and then rinse it off in running water under the tap. But that's where most of the nutrition is in some fruits and vegetables, is in the skin. Well, in flax oil, the vitamins, the minerals are present to help to digest properly the fats that are present in the flax oil. It's just marvelous how Mother Nature has provided this stuff. And the only type of flax oil that will do any good is cold pressed. It's hard to find. The seeds are almost 50% oil, so they give up their valuable liquid oil very easily when compressed. And in a raw state, the oil is from a light golden to brown color, and it thickens easily when it's exposed to air, and it's extremely sensitive to light. So the flax oil that I take is in a dark brown bottle, and I keep it away from the light. You can get liquid, in a bottle, refrigerated flax oil, but it doesn't taste the best. And most of the good flax oils, as I said, are locked up inside capsules inside of a dark bottle to keep the light out. Why? In my practice in the clinic, I take x-rays. I haven't gone digital. I think 2/3, maybe 3/4 of the doctors around the world who do what I do have gone digital. I'm just hanging on to the old film. I prefer that. The film that I take, the x-rays, are just like the old black and white pictures your camera would take. And if you ever did any photo processing, you may have had a dark room in the basement. You like to develop your own pictures, and so people have a hobby of that. And that's exactly what an x-ray is. It's exposed to light that fast. In an x-ray, I have to take it into a dark room where I have a processor. I put the film through the processor. It comes out as a negative, a photo negative. And if I were to put that into a projector onto photographic paper, it would come out looking like a photograph. But the film, the x-ray film, is extremely sensitive to light. As you well know, you don't expose film to light, or it'll be exposed and it'll be all black. There are oils that are that sensitive to light, just as photographic film is. Because some of the most important features of flax oil is the very delicate molecular structure of some of the important parts of that oil, of that acid. The bonds that exist in that essential fatty acid, especially at the third position. That's why we call it omega-3. And that can be broken up by bright light, just like photographic film can be exposed by even dim light. So I have my flax oil sitting on the counter in a dark bottle inside of a box. Now, a lot of some of the liquid forms are packed with they're watery, colorless. Oh, we're almost out of time. Variety available in most health food stores. Most of it is useless. These products have had the solid fats removed. That's why they're watery. Good flax oil on contact with oxygen will thicken up right away. If it doesn't do that, it's not good flax oil. That's why they pour out as easy as water, some of these products. Unfortunately, since essential fatty acids are found in the solid fat, these products are devoid of the very thing you're trying to get from flax oil. So I recommend standard process. Anyway, I could get into this deeper. I wanted to tell you how to feel better in 30 days, but after the use of flax oil, I would be talking about liver, gallbladder function, cleaning them up. There's ways to do that without really difficult cleanses, uncomfortable cleanses. So I'm going to have to save that for another time. But I want to talk a little bit more about the work that we do in the clinic. For those who may have tuned into the show late, I still have that half price thing going on. My initial fees cut in half. I did that as a gift to my K-Talk friends and audience that I am approaching my 32nd year on the air with K-Talk. And the K-Talk audience built my business. So as a thank you, I cut the price in half. There are people who are paying full price that have never even heard of K-Talk. Don't know anything about it. Is that ethical? That question keeps running through my head all the time. But I maintain that as a thank you to the K-Talk audience who built my practice since March of 1995. And there are people that I am still taking care of, that I started taking care of in 1995. I don't see them very often. They have a slip or a fall, or they fell asleep on the couch with their head cocked off to one side, or a fender bender or something. Sometimes they just come by to say hello. Because when you get involved with the deepest aspects of human relationships, you tend to create relationships that transcend even family. You know how in your family, you have certain members of your family you're simply closer to than others. Although you love them all. It's just that, especially if you're in proximity to one. I have 8 kids that are spread from California to what's going to be Spain here in another month. And it's hard to be around them as much as I want. But they're pretty good people. And they've all had spinal care. And they've all been taught the principles of nutrition. And they slip and slide here with those principles now and then, just like I do. I'm certainly not perfect. I'm no poster child for anything. But I have lost 20 pounds since the 1st of December. How am I doing that? Cutting way back on the calories. Just cutting way back. And boy, do I ever feel better. All right. That special is through the end of the month, which is, what is today? It's the 28th. Oh, yeah, 28th. Happy birthday, Dick, in case you're listening. I can see you in February, I can see you in March, but the appointment needs to be made by the end of this week, by the 31st. And then you're scheduled 30 minutes for a consultation. And if you decide at the end of the consultation, this isn't what you're looking for, we'll still be friends. You can go your way and we'll still be friends. If you want me to take care of you, then you're going to be there for an hour, hour and a half, because the initial visit is that long. Follow-up visits are extremely brief. Once I have x-rays and I know your pattern out of alignment and back into alignment, I usually hardly ever, except maybe 1 in 25, need to take additional films down the road. What I do has been around for a long time, but I was the one who brought it to Utah in 1995. There was another fellow here, Dr. Joe, that was doing something like that, but he does a bunch of other stuff, and I think he's still in practice. But it's been a great time. And as soon as I'm done here, I'm going to run off to the clinic because I have a full schedule today of people to take care of. And I don't want to get all, what do you call it, sloppy here right now. I just want you to know I deeply appreciate the parts that you have played in my success. And I want to return that by dropping that price. It's several $100s. It's a several $100 saving to do this. You just call the office 801-523-1890. All right, I'm going to stop the recording right now and save it, and it will be up there at K-Talk. And then, for those of you who were a part of the stream today, I really appreciate, again, if you can like and subscribe and share. We're approaching 900 registered listeners to this program. Obviously, I want to get to 1,000. That will be monetarily beneficial. But thank you for those who listen on the stream. I will bid you a fond adieu. I'll be back Monday. Hopefully, nothing happens between now and Monday regarding Iran, but I'll have some update for you between now and Monday. So for the streamers, thank you for being a part of